Hello and welcome to this session, and thanks for tuning in. Today I want to share with you on a topic called high blood pressure, the complications. Medically, high blood pressure is called hypertension. So what is hypertension and what are the complications of hypertension? I'm sure you have had somebody probably in your family or close to you, a friend who has been diagnosed with high blood pressure or hypertension. So I want you to understand hypertension, but specifically the complications of the same. So let me begin by reminding ourselves exactly what is blood pressure. Now, blood pressure is the force of your blood as it is flowing through the arteries. Remember, your blood flows through the arteries for all your life or throughout your lifetime. As it flows, there's a force that is created against the flow of blood in the arteries. Now, when your heart beats, it contracts and it pushes blood outside into the arteries, into the various body parts. Your blood pressure is highest when your heart beats or when your heart contracts. That is when your blood pressure is highest, and your blood pressure is lowest in between the beats. The heart relaxes. It is called diastolic, and when it beats, it is called the systolic blood pressure. So what is the normal blood pressure and what is high blood pressure? And if there is high, then there is also low blood pressure. A blood pressure is measured or is determined whether it is normal, high or low based on the age. For example, somebody who is below the age of 50, the optimum blood pressure should be between 110 to 130 over 60 to 80. That is a normal blood pressure. Somebody who is above 50, we allow a blood pressure of 140 over 90 to be a normal blood pressure. However, any blood pressure above that would be considered high blood pressure. And therefore, based on the age, it is important that you know or you have a regular blood pressure checkup to know whether your blood pressure is normal, high, or even low. Obesity is a common cause of elevated blood pressure. Taking too much salt, again, lack of exercise, and let me say life modification, lack of exercise, too much sugars or too much carbohydrates that end up causing too much weight are some of the causes of hypertension. I want to take you direct to the complications of high blood pressure, and if your blood pressure is high, what happens to you or what are the dangers of high blood pressure? High blood pressure is regarded as a silent killer. Why so? Because it does not have any symptoms. It rarely has any signs, and therefore a person can walk around with high blood pressure with absolutely no sign or symptom until it is too late. By the time somebody comes to hospital with a severe headache due to blood pressure, it is usually years later, or comes to hospital because of nose bleeding, for example, due to high blood pressure, it is usually too late. And therefore, the way to prevent high blood pressure is regular checkups. You walk into the hospital and get your blood pressure checked regularly. Now, the complications of blood pressure. I would say this: wherever the blood flows, if it is flowing at very high pressure, it is going to cause complications. When blood flows into your brain, if I can start here, at high blood pressure, it will give you complications in the brain. For example, stroke. Right, that is in the brain. It will cause memory problems, slowing of thought, remembering, that is in the head or in the brain. Coming down, if the blood pressure is high in the eyes, it is going to cause vision loss because of something called hypertensive retinopathy. The high blood pressure destroys the small capillaries of the eyes and the nerves, and therefore you get somebody is getting vision loss. Coming down, it can even alter speech due to things like stroke and the facial nerves pulses. And therefore hypertension will complicate each and every organ in the body. Coming down in the heart, it causes cardiomyopathy, enlargement, heart attacks, and I will be discussing this with you in more detail. I just want to show you that high blood pressure causes complications in every organ of the body because every organ requires blood supplied at an optimum blood pressure and not high. Let's look at, for example, in the legs. High blood pressure in the legs or in the lower limbs would cause edema, swelling of the legs. It would cause numbness of the feet. It would cause feeling your feet are heavy, and even pain of the feet, of the hands, of the back, because high blood pressure destroys the nerves. And when the nerves are destroyed, you begin to feel pain, and even you begin to feel numbness. Now, high blood pressure in the kidneys causes renal failure. High blood pressure in the kidneys would impair the function of the kidneys, and renal failure results. And from renal failure, a lot of other complications would follow from there. So, in a nutshell, I want to show you that high blood pressure, if not controlled, would give you complications, is a possible cause of serious deformities and morbidities in every organ that the blood is flowing. So I will mention in detail some of those complications and make you understand what is heart attack, what is stroke, what is kidney failure, why this memory loss, right? Why the swelling of the feet, and what we call varicose veins, prominent veins of the feet, is some of the complications of this condition of high blood pressure. So the best way to approach this is to say, ensure that your blood pressure is normal. High blood pressure would cause complications in each and every organ of your body. People come and tell me, Doc, why do I need to take these medications? Aren't these medications bad for me? And I tell them the benefits of these medications that we prescribe for life outweigh the risks. As long as your blood pressure is maintained in an optimum level, these complications are dealt with. And the opposite of that is even a lot of very high medical bills and hospital admissions, because once kidney failure sets in, once stroke sets in, once complications of the heart, cardiomyopathy sets in, then the treatment, stenting and procedures in the cardiac catheterization labs, it is extremely high. And therefore, the best thing to do about hypertension is prevent it, control the blood pressure, and do not fear taking the medications. The medications we prescribe are safe, they are good quality drugs, and you can be sure that they will maintain your blood pressure at an optimum level.